Hello, this is Dr. Steve. I promised to make a video in response to Jerry's Graston treatment session. Wow, Jerry, that was quite a session. So here goes. I made some notes, so I'm going to be referring to them so I can be coherent here. So what is Graston Technique? Graston refers to a man named David Graston, and he was a machinist and a skier. And the very short story is he got hurt skiing, did not get the care that he felt was necessary to recover from his injury, decided to make some tools and rub on his muscles, on his skin, on his muscles and around the joints to affect the healing process. Now, that became a treatment protocol, and he ended up hooking up with two different universities, and it started to get taught to physical therapists. And then in the very late 90s, early 2000s, a well-known chiropractor, Dr. Warren Hammer, very well thought of, very respected in the area of soft tissue treatment, actually wrote an article, I believe it was in 2001, in a chiropractic newspaper that I had the good fortune of reading. And anything that Warren Hammer wrote, I definitely read, kind of like Louis Simmons and weight training. Anyway, what was surprising to me is Warren Hammer was really big on using his hands and actually touching the body, and he was talking about an instrument, and I was very surprised at that. But given that it was Warren, I decided to look into it a little bit more and found that there were courses that were being given in Graston Technique. And the first courses were started, I believe, either at the end of 2001 or the beginning of 2002. I had the good fortune of taking my first course in June of 2002. There were two sets of courses in Graston Technique, the level 1 and the level 2, which I took, looked at my old CV, found out that I took it in June of 2002 and then again in September of 2002. So I've been using this treatment for a really long time. So what is Graston? Well, Graston is kind of a play off of a Chinese technique called gua sha. Now, not sure if David Graston even knew about gua sha, but it is a healing technique using a bone or some type of beveled edge tool with a little bit of ointment and rubbing on the skin. It's called coining or spooning or scraping, and the word actually means to scrape wind, and in Chinese medicine, wind meaning kind of a cold, so something that's irritating the body, and scraping it out and getting rid of it. And what you're going to cause when you rub are what's called petechiae, or what you saw in Jerry's video was that redness, that damaging of the tissue. It's the extravasation of the blood under the skin, and that causes an inflammatory and a bruising response. So you can think of Graston as kind of possibly maybe a more modern form of gua sha. So another term that is used is instrument-assisted soft tissue mobilization, and you see the acronym IASTM in the literature. And again, it's thought to help the tissue, the muscles, the fascia, which I'll go over in a second, to remodel and to heal. What is the generic protocol in Graston? Well, first we have to examine the area, and we really have to know what's going on. And while I'm talking about this, I must add a disclaimer that this is just for informational purposes. This is not a diagnosis video. This is not telling you this is the only way to treat it or the way to treat it. And if you do try it on yourself, please be careful, but that's 100% up to you. Now, all that said, I use the Graston treatment on myself every week, and I do it pretty vigorously. So I already know what my problems are, so a proper examination to really understand the problem is critical. You can't just go banging away with these tools before you know what the problem is. Also, what's really important is there are significant contraindications to Graston Technique. And the list is long, and I'll put some links in the video to the research papers and all the things that I'm talking about. But for instance, if you're a diabetic, if you're on blood thinners, and you start pounding away, you can really make a mess. If you already have a bruise or a cut, if you have cancer, if you have rheumatoid arthritis, if you have any other skin conditions, it can be an issue. So you really have to preferably get with a provider and find out what the problem is, and do you have any contraindications to pounding on your body, because you can really do some damage. And the first rule is do no harm. So what is the protocol? Once we've done an examination, we need to literally get the tissue warm. That can be done by some gentle massage. Then you can use one of the instruments, which I'll show you in a second. On each area, we call the area of the problem, we call it a lesion, the area that's bothering you. And that treatment may be 30 seconds, 60 seconds, pretty much people agree that maximally about 2 minutes. And then what might we do right after that? Well, a little bit of stretching, possibly a little bit of strengthening, possibly some eccentric strengthening, meaning lengthening of the tissue. So my bicep is contracted, that's concentric, shorten, eccentric, lengthen. We may do some of that right after the treatment. So first of all, what are we actually doing and what are we actually treating? And there's, believe it or not, some disagreement in this area. What is a trigger point? Well, there are these little nodules, and when you get good at feeling the area, we call that palpation. When you get at feeling the area, there's small taut bands of muscle and fascia. It can have some inflammation. They can be sensitive. They may not have proper oxygen flow. And believe it or not, back in 2017, a bunch of experts got together and wrote a consensus statement on what is a trigger point. And they said, well, two of these three things have to be present: a taut band, a hypersensitive spot, and referred pain. Now, referred pain may be pain spreading to a different area. Referred pain, for the purposes of this consensus statement, was deep pain, a dull pain, tingling, or burning pain. So two of those three: a taut band, a hypersensitive spot, and that spot may send pain to that area or refer pain away from that area. So that's what we're dealing with when we're performing the treatment and what we're actually treating. So what do the Graston tools look like? Well, I have my original Graston bar, and yes, it's a metal bar. It has some weight to it, and it has a beveled, I'm going to rotate this a little bit. You can see it has a beveled edge. The Graston tools come in sets. They're stainless steel. Now there's many companies that make tools. They're made out of plastics and resin. I'm going to show you another tool. This is from a company called TML Tools. I happen to like these tools. I'm not part of the company. I don't make any money from the company. TMLtools.com. I really like this. I think it's about $80 now. And again, it has a single beveled edge. They have another tool with a double beveled edge. But I also like it because I can grasp it. A lot of the other tools are made kind of like a pencil, and frankly, from an ergonomic point of view, that puts stress on my forearms, and I certainly don't want to do that when I'm treating myself or I'm treating a patient. And you can see there's a similar looking tool in plastic, and I use the plastic one for travel so I don't have any problems with TSA. So, how do I do Graston Technique? Now, once again, in Jerry's video, it was really painful, it was really nasty. It doesn't quite have to be that painful and that nasty. I use either a raw shea butter or coconut oil, there are many rubs that you can put on the skin, but something that has some viscosity and thickness. I'm going to show you on my forearms and on my biceps because I have similar areas that are tight. I'm going to be pretty generous with the application of this, and it can get a little bit messy, so I always have a towel and some alcohol to clean things up. And I'm going to show you on the forearm. Now, when I do the treatment, I'm going to hold the beveling at approximately a 45-degree angle. I don't want to be flat and I don't want to be straight down. I want to hold it on an angle so we can call it somewhere between 30 and 60 degrees. I'm not going to take long strokes. That is something that I personally don't agree with. I can do 1 or 2 long strokes just to feel the area and get a sense of what's going on. But once I do the treatment, I'm going to focus on short 1, maybe 2-inch strokes. And what I'm going to do is I'm going to rub into the area of the most resistance. And I have to find that resistance. So is it going up? Is it going to the side, to the inside, or is it going back down? Okay, it may be going back down. Yes, I know it's away from the blood flow, but for the purpose of breaking up these tight knots, you want to find the area of the most resistance and rub into that area with a little bit of pressure. You're not trying to jam this thing right through my forearm here. You're just putting a little bit of pressure. Be kind, not too kind, little pain, but you don't have to destroy the person. Now, I can rub, again, for about 30 to 60 seconds. I can also lengthen the tissue, and I'll make a little more involved video on actual treatment, but I can lengthen the tissue while I do the treatment. But for the sake of simplicity, I'm just going to show you rubbing into that tissue area like this. And you can see it's starting to get a little bit red. I'm going to go on the outside of my biceps here. And actually, why don't I do my triceps? Because they really need it. So I'm going to show you. Triceps are a little bit awkward to do, but I really need this, so I may as well give myself a treatment on this video. I'm going to put the triceps in a stretch position, okay, as opposed to a shortened position. Again, bending the elbow stretches the triceps. I'm going to come off the bony prominence, which is called the olecranon, and I'm going to rub toward my shoulder. And on the outside here, you can even hear it. It's pretty taut. And I'm going to rub. And then look to see, does that feel more fluid, a little bit easier? So I like to do a little bit of treatment, test. Do a little bit of treatment, test. Do a little bit of treatment, test. I'm going to continue to rub like this. And not too bad. What I'll do is I'll show you another spot. Now, as some of you know, I had something called an esophagectomy back when I was 50. That's a pretty nasty surgery. And my right side is pretty scarred up. So one really nasty scar, which is a small one up here, was really painful. So working on this spot really is helpful for me once a week. And I really work the tissue. Get my wife to do it as well, because this spot is a little bit awkward. And I'm going to work that spot, and this one I feel, and it's going to get a little bit red. So I'm going to work that tissue. Hard for me to work back up, so I have my wife do it. I have some pretty good scarring in the back here, so I like to work that tissue, especially this spot right in here. And I can use this long bar, which makes it handy. And you're going to see this one get really red really fast. So this is why Turkish get-ups are hard for me on the right, and I'm a little bit imbalanced because I had quite a bit of muscle tissue cut up and taken out, and you can see this one's getting pretty red and this one's pretty painful. So I am going to cause some pain. Please don't kill yourself, especially the first time. This can be some bruising too, can last for a couple of days. So you do have to be careful and pay attention. You do have to know your sensitivities. If you're eating a good diet and your recovery is quick, you're going to see that the bruising is going to heal quickly. But if you're not eating a good diet and your recovery isn't quick, then the bruising is not going to heal. And you certainly don't want to redo this treatment over the bruising that's already there. So typically in practice, I will treat people maybe twice a week with this. We have to see. Everybody's different with it. I hope this made sense. I can make more videos. Please ask me questions because I want you to get the best benefit, and kind of what I posted the other day on Twitter, that I'd love to be that bridge between injury care, injury prevention, and performance, because it's really all the same thing. Thank you.